to today's Pet Podcast. I'm your host, Dr. Roberta Westbrook, and we are here at the Campus for All Animals, the Houston SPCA. Thank you for joining us once again for an exciting topic today. So it is February, and February is Pet Dental Health Month. So we want to get you encouraged and get you knowledgeable about why it's important to keep your pet's teeth clean, how it's going to contribute to helping them live a long, happy life. And we're going to give you some information about dental health care for your pets today. So please get your questions ready and put them in the chat if you want to ask a question about your pet's dental health. And in the meantime, I want to introduce you to our pet of the week this week. Our pet of the week this week is 2-year-old female Alannah. So Alannah is a pet that came to us needing a new home. So unfortunately, her previous family could not care for her any longer, and they trusted us to find her a nice new permanent home where she can live a long, healthy life. So please come on down and meet Alannah. She's understandably a little bit nervous, but she warms up to people quite easily. So if you would like to come visit with her, spend some time with her, show her that she can be loved and will be loved and will find a permanent home soon, please make an effort to come on down to our adoption center, visit with Alannah, and visit with all of our other dogs, cats, puppies, kittens, guinea pigs, and animals that we have available for adoption here. Remember, we are open 7 days a week from 11 a.m. to 6 p.m. There's no appointment necessary. You can just make a day of it, bring your family and friends, and come walk around our adoption center and look at the fabulous animals we have available. So again, thank you for being part of our show each week and part of our family. And again, we are going to give you some information about pet dental health. So, why is this important? I think no matter how long I've been doing this, I've been a veterinarian for 19 years now. And in this 19 years, I continue to meet people who don't know about pet dental health and who don't realize that it's very important to keep your pet's teeth clean, just like we keep our teeth clean, and how it can help lead to longer, healthier lives for our dogs and cats. So I do want to stress that. So let's just get started from the beginning. And the first thing is, the fact that, yes, your dogs and cats have teeth, and those teeth need to be cleaned. And how do we even go about doing that? Well, your veterinarian, your family veterinarian, is going to be your first resource. When you go to your veterinarian twice a year or once a year, every 6 to 12 months, when you're doing a regular routine visit to your family veterinarian, your veterinarian is going to do a full physical exam on your pet. Well, part of that physical exam is going to be to do an oral exam. And typically, your veterinarian is going to be one of the first people that might be able to identify that it is time for your pet, your dog or cat, to get a teeth cleaning. So your veterinarian could find this on their physical exam, but you all at home, as you're playing with your dogs and cats, and maybe they're licking you in the face, you may notice that your pets might need their teeth cleaned too. Typically, what owners notice that makes them say, my pet might need to have his or her teeth cleaned, is they may notice a couple things. Most commonly, it is bad breath, the foul odor, because our dogs love to jump up in our faces and kind of lick us and give us kisses. Usually it's during that time that owners realize that, oh, my pet has bad breath and there could be something going on there. That might trigger you to want to see your family veterinarian. The second most common thing is that as your pet is panting with their mouth open, you can see the surface of their teeth. And oftentimes you can tell that the teeth are discolored. They may be brown or yellow or white in some cases. And that will also trigger owners to say, maybe my pet needs to have the teeth evaluated. And sometimes they may notice that the pet's teeth have fallen out completely. And so you can have any range of those kind of trigger the fact that you need to see your veterinarian. And then your veterinarian can help you determine from there what the next best step is to get your pet's mouth in the best condition possible. So what questions do you have from here?
All right, so we don't want to get into that point where they're falling out. So how do we prevent dental diseases?
Right, absolutely. So it depends on where your pet's teeth are in their health. Let's say you have a young pet. And when I say young, I'm generally saying 3 years or less. And the reason I'm saying this is because statistically, pets that are 3 years of age or older, about 85% of them have some sort of gingivitis, or dental disease. So once your pet turns 3, once they're 3 years and older, it's very likely that they already have some dental disease that needs to be addressed by a veterinarian. But let's say you have a young pet, you have a puppy or pet younger than 3. You may be looking at ways to prevent what we call plaque and tartar and calculus buildup. So just like us, we brush our teeth every day. Pets don't oftentimes have their teeth brushed that frequently. We're educating people about it, but it's not super common yet. So not everybody is able to do this every day. If we're not able to brush our dog or cat's teeth every day, what winds up happening is the saliva, the bacteria, and the food particles that are on the surface of the teeth each day, it begins to build up. Saliva, bacteria, and food particles form a film on the teeth that we call plaque. And it's soft in the earliest stages. If we don't brush that plaque off, it begins to harden and mineralize. And when it hardens and mineralizes, then we call it calculus. We call it tartar or calculus. So when it turns into tartar and calculus and it's hard, we're not able to brush it off. At that stage, you're going to have to see your family veterinarian, and they're going to have to professionally get that calculus removed from your pet's teeth. But what you can do to prevent it from getting to that stage is to do a few things. The first thing is brushing your pet's teeth. And you may say, well, how often do I need to do that? Ideally, once a day. At least brush your pet's teeth once a day. If you can't do it once a day, research shows that at least 3 times a week will be good enough to help to prevent that plaque from turning into tartar and calculus. So let's talk about that. Okay, you want to brush your pet's teeth. There's a couple of do's and don'ts. The first do is make sure that you get a toothbrush and toothpaste that is specially formulated for pets. Okay, so we have a couple of examples here. I have gotten this toothbrush and this toothpaste from pet stores. So you want to make sure that you're using products that are specifically designed for pets. Don't use your wonderful human toothbrush or toothpaste because we want to make sure that we are being safe. And the canine and feline toothpaste is specially formulated for them. Human toothpaste has ingredients in it that can be toxic to our dogs and cats, like fluoride, xylitol, saline, salt. Sometimes those things in too high of quantities can be toxic for our pets. So we do not want to use human toothpaste. Please make sure that you start off by getting toothpaste formulated for dogs and cats. Same thing with the toothbrush. You got to make sure that you don't use your toothbrush. It might be a little bit hard to maneuver. Typically, toothbrushes for canines and felines have a little bit of a longer handle so that we can get further in the back of the mouth, particularly for those breeds who have long snouts and you got to get far back. You need a longer handle. And sometimes the brush portion looks like this, but sometimes the brush portion looks more like a standard toothbrush for humans. And we also have this handy finger toothbrush that you can use for dogs and cats that might be a little bit less scary than the brush. So if your pet is new to brushing their teeth, a little finger toothbrush like this might be a good place to start.
All right. So then let's say we are able to, do the routine cleaning at home. What does it involve cleaning at a veterinarian? How is that process different?
Yes, exactly. So, again, we want you to try to brush your pet's teeth, and we can talk about how you want to start doing that a little bit later, but we want you to brush your pet's teeth at least once a day. But if your pet is already in the stage where they have calculus and tartar buildup and brushing it off is now not possible because now it's mineralized and solidified on the surface of the teeth, then you're going to see your family veterinarian. Your veterinarian is going to schedule your pet for a thorough professional dental cleaning. There's a few things that you should expect from this. Number one, your pet's going to need to be under anesthesia. So they're going to have heavy sedation and anesthesia so that they can do the cleaning professionally and thoroughly. This procedure cannot be done thoroughly on an awake animal. There are parts of the dental cleaning that require a lot of probing and getting underneath the gingiva, underneath the gum line, and it just is not going to be possible to do on an awake animal. So you should expect that your veterinarian is going to do a physical exam and maybe some testing to make sure your pet is healthy enough for anesthesia. Once they're healthy enough for anesthesia, then what the cleaning entails is very similar to when you go to the dentist. We have all of the same equipment that you might actually see at your dentist's office. So when you go to your dentist's office, you might be familiar. One of the first things that they do is take X-rays, radiographs of your teeth. We do the same thing. So this here that you see sort of on the side here, this is a dental X-ray unit. And we have a plate, kind of an X-ray plate. This is very similar to when you go to the dentist and they put the X-ray plate in your mouth and they tell you to close down and then they take the picture. This is the same thing. We put this in the dog and cat's mouth and we kind of close their mouth and then we take a picture of their teeth with our X-ray machine. What this does is it helps us to see if there's any disease processes happening underneath the gum line, things that we can't see. We want to evaluate your pet's roots, the roots of the teeth, to make sure we're not missing anything. So it's very important that your pet get dental X-rays. So there's dental X-rays. Once the dental X-rays are taken and evaluated, now your veterinarian has a better overall view of your pet's health care. The next thing that they're going to do is want to get all of the calculus, the tartar, and the superficial debris off the surface of the tooth. And we do that using a scaler. We call it an ultrasonic scaler. This is the instrument that oftentimes people at their dentist don't like because it's high-pitched sound. It's like, that's this. It's an ultrasonic scaler. But it's very, very effective and very efficient and works very quickly to get all of the tartar and plaque off of the surface of the teeth. And so this ultrasonic scaler works wonders. Now, this is going to get all of the tartar and plaque off the surface of the teeth, but between the teeth, oftentimes we have to use finer instruments. So we have instruments like this. They're handheld instruments, handheld scalers, and we can use these instruments to get between the teeth so that we can get some of that calculus and tartar from between the teeth. So they're a little bit finer instruments here. So you'll have teeth scaling and hand scaling. And then after that, what your veterinarian will do is check for what we call pockets. We call them periodontal pockets. These are spaces between the gingiva, between the gum line and the surface of the tooth. So we want the gingiva or the gum line to be well attached to the surface of the tooth. But sometimes in diseased teeth, there is a pocket that's created between the gingiva and the surface of the tooth. We call that a periodontal pocket. We can identify them with a periodontal probe like you see here. And we don't want those pockets to be deep. Oftentimes when those pockets are deep, that means that infection has gone deeper in the root and those teeth could be more diseased. Certainly your veterinarian has treatment for those, so no worries there. It's just part of the dental procedure. So now that the teeth are cleaned, the next step is you should expect that your veterinarian or your veterinary dental hygienist is going to take a little polisher and just like when you get your teeth polished at your dentist, we're going to take some polishing agent and a polisher, and we're going to polish the surface of the teeth because we want to make sure that the surface of the teeth remain very smooth after we've cleaned them. We want them to be smooth because if they are not smooth, then it can make more of the tartar and plaque buildup on there. So we will oftentimes polish the teeth after they've been cleaned, disinfect the mouth, and then do any other treatments that are necessary depending on the disease process. So it's a very thorough procedure, done professionally, and should be done at least once a year at your family veterinarian.
And if somebody's seen your pet as getting a few extractions, will they still have a good quality of life? Will they still be able to eat?
Yes, I'm glad you brought up extractions because during this dental cleaning, your veterinarian and your veterinary technicians who are working on your pet may notice that your pet has loose teeth or teeth that are so diseased that they need to be extracted or pulled out. And this is not uncommon. So, don't worry too much. It's not uncommon. We can do that very safely. And animals have a really good quality of life, even if they're missing lots of teeth. So there's been times where I've had to pull 15 or 20 teeth out of a pet before, and they go on to still be able to eat. They can oftentimes still eat hard food. Some pets may prefer soft food, but what will happen is the areas where they're missing teeth, it will become very hard, like a solid gingival kind of surface. And so the gingiva, the gum line, will heal over that area where the tooth was. It'll become hard and tough, and they'll still be able to eat. They'll still be able to eat kibble, but you can also soften the kibble with water or add canned food to it. So absolutely, even if your older pet has had to have many teeth extracted, they can still live a very, very healthy, long life with even very few teeth. And sometimes it's cute because their tongue will hang out of their mouth a little bit, so might be a little bit of character added there.
All right, so what are the dangers of us not taking care of our pets' teeth? Are there any like health issues that can be caused by it?
Yes, absolutely. So we don't think about this too often, but all of the tartar and the calculus, it harbors bacteria and it creates a gingivitis. So when we go to the dentist and our dentist tells us, hey, your gingiva, your gum line is bleeding a lot, your gingiva is bleeding, that means that the gum line is unhealthy. We don't want them to bleed. Well, same thing in the pets. When they have a lot of bacteria buildup, it creates inflammation in the gum line, and that creates bleeding. Well, the bacteria in that area can enter into the bloodstream through those bleeding gums. So the bacteria enters the bloodstream. When it enters the bloodstream, it gets carried throughout the body, and it can settle in other areas of the body, causing disease. So common places for oral bacteria, for bacteria from the mouth to go and cause disease are, one, the heart. So bacteria can leave the oral cavity and travel through the bloodstream and go to the heart and cause heart disease. Another place is the liver. So the liver can be affected by really terrible oral health, and the kidneys can also be affected by terrible dental health. So that bacteria can affect other organs, other major organs. And so it's very important that, again, we stay on top of these dental cleanings and we don't let it get so bad to where there's so much bacteria that we're concerned that it's affecting the heart or other organs.
Somebody asked, they've seen a variety of like dental chews. Are those efficient?
Yes, dental chews. There's several of them out on the market. You've probably seen them. So one of the probably the most common ones and popular ones that you can just get at over the counter at a grocery store are greenies. You've seen greenies. So greenies are approved by the Veterinary Oral Health Council. The Veterinary Oral Health Council approves dental products and chews and tells us that, in fact, those dental chews have been proven to reduce the buildup of plaque and tartar. So greenies are one option. Make sure, though, that if it's new for your pet, that you're monitoring them. We don't want them to swallow the greenies whole. We want them to be able to chew them and let it use mechanical action and chemical action to break down the plaque that's on your pet's teeth. So chewing those greenies will mechanically help to clean the teeth, but also the chemicals in there will help to break down some of that plaque. So there's greenies. There's also another product called CET chews. CET chews. Those are also approved by the Veterinary Oral Health Council. These CET chews also mechanically and chemically help to prevent tartar and calculus buildup. So there's lots of options out there. Hill's Pet Nutrition makes treats that you can also use. They're called TD treats that you can use to help to prevent the tartar and plaque buildup. So please contact your veterinarian about prescription treats and diets that can help with your pet's teeth. But there's lots of over-the-counter chews that you can use as well.
And speaking of like strong chews, is it ever dangerous for a dog to like chew too hard? Not just necessarily the dental chews, but a chew in general. Yeah. Should we, be worried about that sometimes?
Yes, sometimes. So yes, there's certainly some specific dental chews that I mentioned that are going to be appropriate for chewing. They're soft, but oftentimes we might buy chews for our dogs that might be harder, like the pig ears and pig's feet and the hooves. These things can be very, very hard on your pet's teeth, and as they're chewing on it, oftentimes small teeth, particularly small breed dogs, but even some large breed dogs, they can break and fracture their teeth on some of those harder chews. So just make sure that you're not using a chew that's really hard, because it can certainly fracture the pet's teeth as they're eating them. Use dental specific chews that are going to be a little bit softer and easier to digest.
And if a dog does break a tooth for whatever reason, do they heal on their own, or do they have to seek some help?
So what do you do if your pet breaks a tooth on one of these chews, or even roughhousing with a toy or something like that? Well, you do need to see your family veterinarian, because the outer layer of the tooth is called enamel, And, under that enamel, there's a couple of other layers of the teeth. Well, when we fracture a tooth, sometimes what we expose when we fracture the tooth is the innermost layer, which is called the pulp cavity. And the pulp cavity, and underneath the gum line, we call it the root canal. But those deep layers of the tooth contain living tissues. They contain blood vessels and nerves. And so they can be very painful. So when a tooth gets fractured and it exposes the underlying blood vessels and nerves, it can actually be very painful and at least make your pet very sensitive. And so seeing your veterinarian is important because they need to determine what to do with that tooth. Is it fractured so severely that the tooth needs to be removed and extracted? Or is there some restorative procedure that can be done to seal the tooth, to seal the fractured surface of the tooth so that it's not sensitive anymore and those living structures can be preserved and won't die? So please see your family veterinarian if you notice that your pet has a broken or fractured tooth.
And Janine from Facebook is wondering, they've seen the liquid to put in the water to help with their teeth. Can that help? And I've also seen powder on food.
Yeah, so certainly some of those products may help. It may help to, reduce the bad breath that you're noticing. They may not help significantly at preventing plaque and tartar buildup, particularly if your pet already has that. But once your pet gets his or her teeth cleaned and there's a clean surface, that would be the best time to start these new products that you put in the water and the food. So if your pet already has plaque, tartar, calculus buildup, these products are probably not going to be effective until you get your pet's teeth clean, and then they can certainly help to prevent it from being getting worse faster. Yes, thank you. So I know we've discussed a lot here today about dental health, but remember, it's Dental Health Month. Please talk to your family veterinarian about getting your pet's teeth cleaned this month. They may have some specials going on, but it's going to help your pet live a long, happy life. In the meantime, I want you to be aware of some things that are happening exciting here on our campus. The first thing is that Critter Camp is coming up. Critter Camp is going to be open. It's for young children that are interested in veterinary medicine, want to learn all about animals. We're going to start early bird registration for our summer Critter Camp on Monday, February 6th. So please visit HoustonSPCA.org, look for our Critter Camp link, and get your child or your friend, signed up for our Critter Camp this Monday, the February 6th. Then also, we are going to have, week-long adventures in our Critter Camp. So please, get those kids signed up. We'd love to have them as part of our family, and visit our website for other opportunities to be part of our family, fostering, volunteering, or even being a monthly donor. All of those things help us to do what we do every day of the year, saving animal lives and finding them new homes. So thank you so much for joining us. We appreciate you joining us each week here at the Pet Pawcast. And again, I'm your host, Dr. Roberta Westbrook, and this is Alannah. Come visit her, and we'll see you next week.